Postoperative healing after endodontic treatment of teeth with apical periodontitis in controlled diabetic patient, a cohort prospective study by Ali and Amin from the University of Cairo in 2019. Diabetes mellitus is a disorder characterized by hyperglycemia and can manifest itself as type 1 and type 2. Diabetes alters many functions of the immune system and is commonly associated with delayed healing and compromised immune response. The aim of this prospective cohort study was to assess whether postoperative periapical healing of apical periodontitis and postoperative pain differs in patients with controlled diabetes type 2 compared to diabetes-free patients after receiving a single visit root canal treatment. For the methodology, 37 patients were recruited for root canal treatment, 20 patients in control group and 17 in diabetes group. The inclusion criteria was necrotic teeth with apical periodontitis without previous intervention. Patient age was ranging from 18 to 60 years old, and in diabetic patient the metabolic control was determined preoperatively by measuring the HbA1c. Postoperative radiograph was taken using a film holder as a baseline record, and at the end of the visit using a stent prepared previously for standardization. All patients were requested to fill the numerical rating scale at intervals 12, 24, 48, and 72 hours and 7 days to return it at the next visit. Each patient was given a pack of 2 placebo capsules to be taken in case of pain only. Primary outcome was the periapical healing at 3, 6, 9, and 12 months after root canal treatment, and periapical healing was measured by modification index of Sternberg study that was used for radiograph healing assessment using the same parameter applied with the preoperative radiograph. For this study in both groups, there are independent variables including preoperative factors such as age, gender, preoperative pain, swelling, and diameter of radiolucency, in addition to all intraoperative factors such as presence of pus. For the results, it showed that there was no statistically significant difference between the two groups regarding the demographic data, smoking habit, tooth type, and tooth arch, while statistically significant difference in the mean age value where diabetic patients were older than non-diabetic patients. Clinical and radiographic findings show no significant difference between the two tested regarding preoperative pain, presence of sinus tract, and diameter of radiolucency. On the other hand, preoperative swelling was found to be more in diabetic group than non-diabetic group. Postoperative pain finding obtained by numerical rating scale showed a significant difference between diabetic and non-diabetic group. On other hand, the diabetic group patient showed a higher incidence of pain than those of the control group. Radiographic postoperative finding indicates that control and diabetic group did not show any significant difference in terms of healing at 3, 6, 9, and 12 months. 5 diabetic patients took antibiotic compared to 1 in control group with no significant difference due to development of postoperative swelling. Significantly more patients suffered from postoperative pain at 12 hours in diabetic group compared to control group. Control and diabetic group did not show any significant difference regarding healing at 3, 6, 9, and 12 months. In conclusion, both groups with necrotic teeth and periapical periodontitis were successfully treated regarding the healing of periapical lesion. Single visit could be done in diabetic patients on condition that their medical status is stable and their blood glucose level is controlled. Healing could take up to 1 year to be obviously seen.